Hi, this is Dr. Fowler. I'm going to do a little video for you on some of the more common foot problems that present to our office. So if you have an aching, tired feet, you might want to watch this little video, tell you how to get rid of the pain. So this is a foot. There are 27 bones in the foot. Heel. This is the inside of your arch. Big toe, outside of your foot. One of the most common problems that happens over time is fallen arches. So with age, pregnancy, trauma, the ligaments in your feet start to loosen, and instead of having a nice high arch like this, the foot collapses. And if you watch my thumbs, you'll see how they spread apart. That spreading apart causes a number of problems. One, it jams all the joints on the top of your feet. So if you have any pain up on the top of the ankle, on the outside of your foot, or through this part, it can be from fallen arches jamming the joints. Secondly, there's a fascia or tendon-like substance that attaches to the heel, comes down the bottom of the foot, goes to the big toe and up to the tip of the toe. Its function is to help you propel off and move forward with power. But with time and collapsing of your arch, you can see the pulling that occurs on it, and it yanks on the heel, causes it to bleed, becomes inflamed, it can make a spur, and you get heel pain, either on the bottom of your foot, on the back side of your foot, or sometimes all the way up through the bottom of the foot to the big toe. It's called plantar fasciitis. So we have plantar fasciitis, we have jammed joints. In the big toe, we get a number of problems from the same fallen arch. One is, at this joint, the tendons that come down the side of your foot that stabilize it can no longer do their job when the foot is in this position collapsed. So we get a big spur on top of the great toe. Many of you will feel that when you pick your heel up and try and move forward, you get pinching at that spur. In addition to that, with fallen arches, the first set of bones, we call it the first ray, splays immediately like this, and then the big toe itself comes across to the outside, and this bone pops out. It's called a bunion, becomes big, red, sore, and inflamed, and it pops out the side of your shoe, much like the ones I have. In addition to that, this condition is called hallux valgus, by the way, where the toe crosses over. It can eventually undermine the second toe, and it will pop up and over it and be functioning like that. We call that a hammer toe. So you get a hammer toe, bunion, dorsal exostosis spur, and then as this first set of bones is unstable because of the tendon not being able to hold it well with fallen arches, the push-off pressure, which should be on the first two bones, becomes on the second and third. You see a big callus under these people, and they get inflamed joints right here called metatarsalgia. So if you have pain in this area of your foot, it's metatarsalgia. This is dorsal exostosis, hallux valgus, bunions, and a whole host of other problems that can stem from it. So what do we do to fix this stuff? Well, obviously we can adjust the feet in the opposite direction of the compaction that occurs throughout normal daily activity and fallen arches. We need to loosen the calf muscles all the way up to the back, because when they are tight, instead of the leg bone moving forward at the ankle, it will also pick up on the heel and jam the joints. I don't know if you can see that well. Open joints, jam joints. The long-term correction for this, instead of taping and coming in for ultrasound and lots of visits, is to make a well-made arch that fits snugly up into the foot that prevents all the wear and tear on the feet. There's only one company that makes those kind of arches. It's called Sole Supports. And we can actually send you a box. You can probably cast it at home if you want. Otherwise, you can come into the office or find a practitioner that uses Sole Supports. If you use, and you may say to yourself, well, I've already had orthotics, they didn't help. With regular orthotics or custom-made insoles for your shoes, when your practitioner casts your feet, first of all, they won't have you on maximal arch height. It's not taught except by one lab. Secondly, when the orthotic imprint goes out to the lab, they also flatten the arch 13 to 15 degrees. So now, instead of having a nice tight fitting support up under your foot, it's down here with a hard shell, and your foot slams into it and causes pain along the feet. So the long-term correction is to make a well-made orthotic, and then we do a lot of other things like adjusting. We break up scar tissue with these little metal tools. It's called Graston instrument-assisted soft tissue therapy. We get in there and break up all the scar tissue around the feet. That helps a lot. We use a class 4 cold infrared medical laser that's really great. Looks like this. All you do is put it on. It's very comfortable and produces a very, very powerful light with 2 frequencies. One for inflammation, one for pain. It brings in a lot of blood flow, produces a lot of energy production. Enzymes are made. Basically makes your cells into super healers. So between the laser, sometimes taping the foot, adjusting, correcting tight muscles, fascia, and using supports, we can correct many of these problems and alleviate almost all pain that comes in with foot problems. If you have any questions, call the office. Thanks for listening.